Priya is a 34-year-old pediatric nurse who spends her shifts lifting children, but right now her shoulders ache like she slept on stone. Her skin slinches at the seam of her sweater, and by mid-afternoon, her thoughts move like they are wading through water. Yet her medical folder contains perfectly clean blood work and clear scans. Every inflammatory marker and thyroid panel reads exactly the way a healthy person's chart should. Her doctor glances at those numbers, delivering the sentence she's heard 6 times this year. Everything looks normal. He means to be reassuring, but to Priya, the subtext is clear. Her pain is imagined. A normal blood test is a map, and it is quietly pointing at the one place a blood test was never built to look. It identifies exactly where the problem is not hiding. The pain is absent from her muscles. The tissue she keeps pressing on, hoping to find a sore, guilty knot, is biologically innocent. For decades, chronic pain was viewed through the lens of the body's plumbing. But when the pain is real and the blood is clean, the fault sits one layer up, in the electrical box, the central nervous system. This system contains a volume dial for pain. In most people, it sits at a reasonable setting, but in millions of others, the dial gets stuck on high. It amplifies every signal, tagging a light touch or warm shower as severe pain. When clean paperwork meets genuine agony, the underlying disease is simply hiding in the system that decides what counts as pain in the first place. To find the amplification's source, we travel deep into the spinal cord circuitry. Often, a trigger floods this area with a rapid drumbeat of signals. The spinal neurons respond violently to every identical pulse, gathering momentum the injury never required. Researchers call this wind-up. It is a biological score-keeping process, where a flat, unchanging input from the body creates an exponentially rising output from the spine. In 1983, scientist Clifford Wolfe demonstrated that even after completely anesthetizing an injured area, cutting off every possible signal from the skin, the heightened pain response in the spine remained. The amplification had already moved upstream. Because the spinal cord actively learns, a biological alarm and outlive the fire that set it off. Inside the dorsal horn neuron, we can see the exact chemical trap that locks this hypervigilant state into place. This NMDA receptor is normally deactivated by a magnesium stopper. Rapid pain signals build an electrical charge that pops the stopper free, allowing a flood of calcium. This rewires the cell, widening its reach so neighboring healthy nerves get folded into the pain. The dorsal horn neuron has become an overtrained smoke detector. It shrieks at burnt toast because it learned that danger was everywhere, and it was never told that the threat had passed. This constant oversensitivity pulls massive amounts of energy. The brain spends so much current managing the alarm, there is little left for memory or focus, resulting in the wading through water feeling of fibrofog. This is the physical reality of an overprotective system. The exhaustion and the hypersensitivity are evidence of a body that learned its lesson too well and forgot how to unlearn it. Returning to the clinic, the phrase "everything looks normal" takes on a different meaning. It points directly away from local wounds and toward the electrical system. Medical interventions will continue to fail as long as they focus on repairing a ghost wound that healed months ago. You cannot fix the wiring by prodding the muscles. Hope lies in the same plasticity that cranked the volume dial up. The nervous system can slowly and stubbornly be taught to turn it back down. This requires therapies aimed at the central nervous system, graded movement to prove safety to the spinal cord, sleep repair to stop the daily amplification loop, and medications that shore up the brain's internal brakes. Naming the mechanism, central sensitization, is the first step in shifting the map. It acknowledges that the pain was scientifically real the entire time. The evidence was simply hiding one layer up from where everyone was looking.